Hello, my name is Dr. Mel Irvine. I'm a provider located here in Southwest Florida. Today we're going to be talking about testosterone replacement therapy and a particular condition that some men suffer from called Peyronie Disease. If you've seen some of my other videos or anything here resonates with you, please subscribe to our YouTube channel at Dr. Mel Irvine. So today I have a patient of mine, Tim. I'm going to let him introduce himself and kind of give you some idea of what we're doing for him.
Hello, my name's Tim. I'm from Bonita Springs. I'm 59 years old. Retired firefighter. Love to travel. Love the outdoors. And Dr. Mel's been helping me, and it's making life a lot better than it was before I came here.
Perfect. And now you're living the best life, and what you should always. You've always been living a cool life, though, because you've traveled a lot over the years.
Yeah, I always loved to travel. I grew up surfing and fishing and real outdoorsman. So I don't want anything to hold me back.
Yeah.
And freedom is in the doing, not in the thinking about it, is for me, doing it.
Yeah.
I have a lot of free time, and down here in Southwest Florida and the close islands that are around here are to be enjoyed. Beautiful, a lot of fishing, a lot of surfing, and you know, to be healthy is the number one thing, and to keep up on my health and come to places like Revitalize is the answer.
Yeah. And so currently we're doing testosterone replacement therapy for Tim, and also coupled with platelet-rich plasma therapy, PRP therapy, for the Peyronie Disease. So when you came to us with the Peyronie Disease, tell us a little bit about before you came and what you thought as far as the condition you had and how you felt. It's not easy to talk about. Guys don't really talk about these kinds of things.
I'm not your average guy. Anyway, you know, I had thought I damaged myself first and foremost because I didn't know what was going on, but I knew something was very abnormal. I had almost like a break, like a curvature of my penis that was very, very curved.
It was about 90 degrees when you first started coming.
It was looking like a broken finger, to tell you the truth.
Yeah.
And then I started to notice the erections were smaller, the girth was thinner, the length was way smaller, and like I said, I thought I injured myself. I couldn't put anything together about an injury other than I surf a lot, and you lay on a hard fiberglass surfboard. And lots of times when the surf gets strong and you're paddling out, you shimmy a lot in that area. And I had a friend of mine that had done some research and told me what I had, and told me what possibly the solution was. And to tell you the truth, when I heard about needles in the penis, I was very hesitant. It took me months to make an appointment.
Yeah, to actually get in here.
Yeah.
But I'm glad you did.
So
we've done 2 injections so far, and essentially with these injections, we're working on what he's talking about with this curvature. He had sustained damage to the penile tissue, but more importantly, the protective lining to the chambers in that tissue, the tunica albuginea, and that fibrotic plaque was beginning to pool in a way because of the internal tissue also beginning to change, and it was beginning to shrink and atrophy and start causing this curvature. So essentially, we work on 2 things when we're working on Peyronie disease. We work on penile tissue atrophy, which will happen to all men. That tissue internally begins to shrink and it becomes fibrotic and hardened. And we work on the plaque itself that becomes damaged. And it's, you know, again, it could have been over the years, you were very active in multiple different types of sports and then surfing, and repeated injury to that tissue. You know, it's like when you bite the inside of your mouth, you sustain an injury there and then you repeatedly bite the inside of your mouth in that same spot. That's kind of what happens with Peyronies as well. So since we've done the injections, typically we do a series for Peyronies, anywhere from 3 to 6 injections, depending on the severity of the degree of curvature, and every man will respond different to the treatment. We've done 2 injections for you so far, and where, you know, How are we doing now as far as curvature? And we know the erections have very much improved as well.
Yeah, I saw instant results, you know, even after the first time. And I'd like to tell men, the needles don't hurt. It's very, very minor little pinch.
Yeah, we know.
And
we do a good job.
that certainly helps to get in here.
Yeah.
But noticeable results after the first, and very noticeable after the second. I could tell, you know, it's really working. The curvature is very limited after only 2 times. The hardness is impressive.
Yeah. We were talking about
length's
that.
better, the girth's better. I mean,
Yeah.
as you can see, I'm smiling. I'm not frowning or hiding. And, you know, using the pump, everything that you've suggested that I've done, but mainly what's been done in here,
Yeah.
is uplifting.
Yeah.
It's definitely not only, you know, uplifting, but the mental state of mind I was in before this, and, you know, not wanting to socialize
Yeah.
was very depressing and going to get worse. So it's one of the best things I've done for myself, and one of the best things that I've done, and want to continue to follow up on these procedures.
Yeah, that's awesome. And that's how we want it to be for everyone. So you're a beast. That's awesome.
Thank you.
All right. Well, if you like what you hear today, again, subscribe to our YouTube channel, Dr. Mel Irvine. You can also visit our website at drmelirvine.com, kind of check out what we do. You can text or call us if you're here locally, or even if you're not. I do have guys that travel from out of town. You can text us or call us at 239-351-5663. Thank you for listening.